I did a degree in genetics straight from school, and realised partway through that I wasn't cut out to be a scientist, and I was actually more interested in being a nurse. I worked as a staff nurse on wards in the community. I've also worked in hospice, generally sort of trying to move up a grade when I've moved jobs, but I've also moved to different areas to get different experiences. I moved from working as a sort of family support nurse at Great Ormond Street. I went to be team leader for a home care team at a children's hospice, and then was promoted to manage the whole service, and then from there came to work here. I think all the decisions I've made have been about my interests and thinking about what I want to do and where my skills will be best used. My role encompasses about 50% clinical work. I see patients within the multidisciplinary Huntingdons disease clinic. I have my own nurse-led clinics, and I also run telephone clinics. I also advise other clinicians, because one of the things about Huntington's disease and some of the other inherited conditions that I work with is that not very many people know about them. In terms of research, yes, I'm part of other people's research, but I've also led on my own research projects as well, and have worked with other nurse researchers. So one project that I did was with the Sue Ryder Department of Palliative Care at the University of Nottingham, and we got some funding to look at end-of-life care for people with long-term neurological conditions, particularly Huntington's disease, because it's sort of my area of passion, really.